This module of Acessa U is the clinical study review. As a background, Halt Medical has performed pilot, pivotal, and post-market studies. The data presented here begins with the pivotal study and proceeds through the ongoing post-market studies. The first large Acessa study was the FDA-mandated pivotal or Phase 3 study. Prior to marketing the device in the United States, the company was required to perform a large, prospective, multi-center, single-arm clinical trial. Subjects were screened and enrolled in 11 centers, 9 of which were in the United States. A large part of this screening was objective: menstrual blood loss measurements, MRI, ultrasound, and blood tests. If a subject qualified for the trial, they were treated and followed for up to 3 years. Imaging of the fibroids occurred in 3 ways. Laparoscopic ultrasound was performed at the time of surgery, but contrast-enhanced MRI and transvaginal ultrasound was performed at baseline and during follow-up. Here is a chart that shows the number of fibroids located at the time of surgery as compared to the number of fibroids found with MRI and ultrasound. You can see that about twice as many fibroids were found at the time of the laparoscopic ultrasound scanning as compared to the transvaginal screening. Submucosal fibroids were imaged significantly less than intramural fibroids. The objective menstrual blood loss measurements were taken at baseline and again at 3, 6, and 12 months post-treatment. About 8% of women were not able to submit their pads and tampons for analysis. For 3 of these women, pregnancy had stopped their menstrual flow. The 4 women who experienced amenorrhea had day 5 FSH values less than 25 milli-international units per milliliter pre-treatment. Their 12-month post-treatment FSH was greater than 40 milli-international units per mil. Their mean age was 50 years old. Note that the blood loss reduction at each time point in the remaining subjects was significant at all time periods, but was the greatest at 6 months post-treatment. Lukes et al. Demonstrated that a 36 mil drop, which equated to a 22% reduction, was meaningful. Note that our population had a mean of 113 mil reduction per cycle, which equated to a 41% mean reduction in menstrual blood loss. The UFS Quality of Life questionnaires administered at baseline, then periodically post-treatment, showed that the mean health-related quality of life scores, in purple, rose from 37 to 75 at 3 months and stayed high for all 3 years. Likewise, the mean symptom severity scores were high, a mean of 61 at baseline, but severity scores decreased post-treatment to a mean of 29. Also, note that the benefits are rapid and sustained out to 3 years. Here is another way to look at the quality of life scores. The EQ5D Euroqual health state scores are a measure of general health and well-being. Subjects in the study had a mean health state score of 71 at baseline, and that quickly rose to 85 at 3 months and hovered at that level for all 3 years. The second objective measurement of treatment impact was the reduction in uterine and fibroid volume. The chart on the left shows the mean uterine volume, and on the right is the mean total fibroid volume. Both were measured by contrast-enhanced MRI. Note that there was a steady decrease in uterine volume at 3 and 12 months, and a corresponding decrease in the mean fibroid volume over the same time period. To summarize, there was a continuous and significant improvement in quality of life, a continuous and significant reduction in symptom severity, uterine fibroid volume, and menstrual blood loss, and a low surgical reintervention rate coupled with a high rate of patient satisfaction. Now let's look at some post-market studies. Halt Medical initiated 2 post-market studies in Germany and Canada at the end of 2012. Both studies are ongoing, so the following slides reflect the data collected to date. Let's look at the Leicester study first. The Leicester study is a prospective, randomized, controlled trial comparing Acessa to laparoscopic myomectomy. Subjects were enrolled and blinded to their treatment assignment. At the time of surgery, after laparoscopic ultrasound measurements were taken and fibroids located, the surgeon called the office to obtain the treatment assignment. 50 subjects were treated over a period of 7 months, and treatment allocation was 1:1. The primary outcome results were published by the principal investigator with subsequent publications by the co-investigators over the next 2 years. The 3-year results will be published within months. The primary endpoint was total hospitalization time. The myomectomy group had a mean hospitalization time that was 3 times longer than the Acessa group. Interestingly, the laparoscopic mapping time was 6 minutes for both groups, and mean surgical time after randomization was 14 minutes shorter for Acessa, but more fibroids were treated. These are the reasons for the overnight hospitalization. Note that overnight hospitalization is standard in Germany whenever they do a myomectomy. The day surgery was a newer concept after Acessa. There were nearly twice as many intramural fibroids treated in the Acessa group compared to the number excised in the myomectomy group. In total, only 80% of the fibroids found with laparoscopic ultrasound were removed in the myomectomy group compared to nearly all of the fibroids being treated in the Acessa group. One Acessa subject had vertigo related to anesthesia. One myomectomy subject had a hematoma related to abdominal entry, and one Acessa subject had hypermenorrhea upon the first menses. This subject had a DNC at a local hospital, which resulted in a perforation and subsequent infection and hysterectomy. There were no complications related to the device. Remember, lower symptom severity scores are good. Look at the similarities between the 2 treatments from baseline to 36 months. Higher health-related quality of life scores are good. Look at the similarities between the 2 groups at out to 36 months. General health state scores were consistently higher for the Acessa subjects over time than they were for the myomectomy subjects. As in the IDE study, we found that 3-month scores were fairly predictive of 24 and 36-month scores. One Acessa patient had a myomectomy in year 1 because she wanted to get pregnant and the fibroid was still visible on ultrasound. The other reintervention in year 1 was in the subject that had the DNC with perforation. In year 2, there were no reinterventions. In year 3, there were 2 reinterventions in the Acessa group and 1 in the myomectomy group. In summary, Acessa subjects experienced and reported fewer days on pain medications, fewer days missed from work, quicker return to normal activities, and consistently greater degree of mean health state scores. The myomectomy group had a lower reintervention rate at years 1 and 3. Both groups had similar degrees of improvement in overall UFS quality of life scores and similar perceived decreases in menstrual blood loss and treatment effectiveness. Both groups would recommend their treatment to a friend with symptomatic fibroids. Now let's look at the TRUST study. The TRUST study is a prospective, randomized, controlled study comparing Acessa to myomectomy and uterine artery embolization. The primary endpoints are the cost of treatment and acute serious complications. The TRUST study originally kicked off in Canada and has now been opened in the United States. The data presented here is from the one-year Canadian data results in the Group 1 Acessa versus myomectomy subjects. Note that the number of skin incisions, intraoperative blood loss, hospitalization, discharge time, return to work time, and return to normal time are all lower with the Acessa treatment compared to myomectomy. There were no perioperative complications with Acessa, but there were 5 complications after myomectomy. Conversely, there were 4 Acessa subjects seeking reintervention in year 1 compared to 1 myomectomy subject seeking reintervention in the same time period. These are the symptoms that subjects expressed at baseline and 12 months post-treatment. Note that more myomectomy subjects continue to have heavy bleeding, increased abdominal girth, and dyspareunia at 12 months, whereas more Acessa subjects had dysmenorrhea and urinary frequency that persisted. This is the same UFS quality of life questionnaire that was used in the prior trials. Results are similar in both symptom severity and health-related quality of life. Acessa subjects started with a lower mean health state score at baseline, but improved 27.5 points. Myomectomy subjects improved by about 17 points. Both Acessa and myomectomy subjects expressed satisfaction with their treatments, would recommend their treatment to a friend, and reported that their treatment was effective in eliminating symptoms. These results are from the one-year follow-up data. The study is ongoing and continuing to enroll subjects in both Canada and the United States. There are 20 Acessa articles published to date. This is the list of published articles by author. If you have any additional questions about the clinical data, please contact your Acessa representative. Thank you.